nurse by profession. I've worked for 35 years. When you're sick and you go to hospital, you expect to be treated, and as you're getting your treatment, you also expect the correct treatment to be given. So when you walk in, you're supposed to give your names, give the correct age. There's no need of hiding your age, because each disease comes with some age. So if you hide your age, you will misdirect the doctor, and they may not be able to come with the correct diagnosis. So be honest about your age. Be honest about your names. We have seen cases of where people don't give the correct names because maybe they're using somebody's insurance, and then they go to theater, they get operated, and they die. Now it is a court case, because now we have to change the documents to show the correct person, and it becomes a legal matter. So it is good to be honest. Give your correct names and your correct age, and even the telephone numbers. When you become critical and you're admitted, they always ask for your next of kin. If you do not give the correct number, we shall not be able to inform your next of kin when your condition changes, or when we want to call you in case there are results that have come out and you need to be informed as a matter of urgency. And since you gave the wrong numbers, we shall not be able to get hold of you. So it is good to give your correct age, your correct age, and your correct telephone numbers. Now, another thing, when you're asked about allergies, please just give, if you don't know, say you don't know. Instead of giving just imaginary answers, and maybe that drug is the one that would have cured you and it is less expensive, then also it will mean that you'll spend more money on your treatment. So honesty is a virtue. You need to be honest when you go to hospital. Now, maybe you have been seeing many doctors, and you have gone to different hospitals. Then you go to a new hospital, and you do not tell the doctor that you have been treated and that you have been having that problem for a long time, and you've been taking many medicines, and that you have been doing many tests. So you make the doctor start from square one, and that means it's more cost. It's wasting your time, wasting your money, because the doctor will start again with the basic investigations. So be honest. Just say the many hospitals you've gone, the many tests you've done, and whatever the results were. Do not withhold any information. Now, when you're being asked about your illness, you start it from the beginning, where it started, everything that you have been going through to the present. Because if you only talk about the present, we shall miss out many things that are important, and you may be treated the wrong. You may be given the wrong treatment. So you start describing. Let's say when you go to the doctor, think of your head. Maybe you have a headache. You say, once in a while I get a headache. You go to your chest or your neck. You say, I get pains on the left or the right. Then you go to your chest. You think where you get your pain. Then maybe you go to your stomach. You think if you get any pain. Then you say whether about your stool, whether it is normal or not normal. Then you talk about your urine, how often you pass urine, what color is it. It is good. By the way, when you go to the toilet, it's good to look at your stool and good to look at your urine, because it will help. It will help the doctor treat you. So you talk about your urine, you talk about your stool, you look your legs, maybe the pain, your skin, maybe it has changed color. And for the women, it's good once in a while to press your nipples. You see if you have any discharge. For the men and women also, you check whether you have any discharge. Do not hide, because it is part of your treatment. And then maybe you're going many more times. Observe whether you're passing stool many more times, or you're passing urine many more times. Those are part of the things that help the doctors to treat you and to be able to know exactly what is your problem. So if you miss out one thing and you highlight on another one, they all come together. It is one body, so they all come together. And then it is also good to tell the doctor when you're able, like now maybe they give you tests, they tell you come on a specific day. Just be honest. If you can't come, just tell them on that day I'm not available. If they are planning some treatment for you, it is good also to work with the doctor and tell them on this date I will not be available. Can we do it on this date? Can we do it at this time, because you're occupied? And then also you need to talk about your family. Some of the diseases like diabetes and hypertensive, they'll ask you, is there high blood pressure? Is there diabetes? Is there any other illnesses, asthma? Just be honest. It is part of you because you came from, that is your genes. So it is good to be honest. Then when you're given that medicine, please take it as you've been told. Because if you do not complete the dose, then that problem will not go. Because when you're given the medicine, they expect you to finish it. So if you take half of it, you have treated your disease halfway. So when it comes back, it will come times 2, because those microorganisms or whatever is in your body has multiplied and it has become immune to the medicine you are using previously. So you will keep taking medicine and you will keep taking half doses and you will keep going to hospital. So it becomes very expensive. Now, when you're also given drugs, please do not mix them. Do not mix your drugs. It is good when you go, you tell the doctor, I take this drug, I take this drug, I take this drug. If you go and then you have other hormonal, they call them hormonal or multivitamins or kienyeji, there are many things that please do not mix them with the drugs that you've been given in hospital. First, finish your treatment, and then if you want to go the other way around, that is up to you. But first, take your drugs, the ones that have been prescribed. And even when you're seeing the doctor, in case you've been taking them, it is good to tell the doctor, this is what I have been taking, so that they will decide whether you need to stop them or you need to continue or how to go about it. But do not start mixing your medicines without informing your doctors. Then when you're able to go to hospital and when you see your doctor, it is good to be comfortable with your doctor. It is good to have a rapport. So when they're planning for your treatment, they should tell you what to expect and what is the way forward. And also you should also be asking questions. How long, after how many days after I finished my treatment, do I expect to get better within 3 days, 4 days? Because some medicines you're given for 2 weeks. If after 4 days there's no improvement, maybe you should ask, do I come back? Because if I'm not seeing a change, maybe they'll tell you finish the whole dose, or they'll tell you if you take after 2 days and there's no improvement, come back. So you need to have that discussion, and also you need to have the discussion of the way you'll take your medicine and you keep your time. Last but not the least, keep your time for the drugs. If it is 2 o'clock, carry them. If you're traveling or at 2 o'clock you will not be able to go back to where the source of the medicine is, carry it with you. That way you do not miss your dose, and that way you're able to continue and complete the dose. Now there are some you're told, avoid alcohol, avoid milk, avoid many things, avoid. Please follow the instructions, because they make the drug not be able to work well, or you may develop complications when you mix with the alcohol. Some drugs you take, you may start even diarrhea, vomiting if you're taking that alcohol, or even vomit. Some you take with milk, they will not be able to work properly. So follow the instructions that you're given, and keep the time that you're asked. And even if you miss that drug, does not mean you take a double dose, because that becomes an overdose. Just because you missed the time, now you decide you'll take the 2 doses together, that becomes an overdose. So if you've missed it, take it the time you've remembered, and then you continue with the prescribed time. And make sure you take your drugs correctly, and you're honest with your doctor, and you're able to give the correct history.